Hey everybody, we're here at the HIMSS25 Interoperability Showcase where we're doing a demonstration station with our friends from Epic, BBraun, and InnoVision. And we're talking about point of care identity management today, which is designed to improve the overall workflow and association of device and patient information to aid in patient care delivery. We're going to be looking at two different scenarios today. First one is kind of the happy path where all systems are in place and information is flowing seamlessly and interoperability exists. And then we'll actually show the unhappy path where we have a break in that PCIM interoperability, and as a result, information is not flowing ideally for the patient.
Mark is a 35-year-old male patient who presented to the emergency room after a serious car accident and obvious head trauma. He is immediately admitted to the ICU for treatment and monitoring. Upon arriving to the ICU, he is started on a normal saline infusion.
When I open Mark's chart, I can see that a sodium chloride infusion has been ordered. To begin infusing, I start by scanning the barcode on the medication to ensure we have the right medication. I'll check that all the fields in the infusion medication form look correct, and then to associate the pump, I'll scan the barcode on the device to create that association, fill out the form, and then when I hit send details here, that'll generate an order interface message to the pump.
Now that we have our pumps associated, our patient Mark, he bends his arm and creates an occlusion at the BBraun pump, at which point that alarm is now able to be sent out to our central monitoring unit at the CMU and also at the end user mobile device's phone. Well, we will be able to see an alarm come through and the details of what alarms are happening at the bedside.
So the nurse enters the room finding that the patient has bent his arm, which is now causing your downstream occlusion. She is then able to address and restart the infusion, resolving the alarm and getting the infusion running again. This ideal workflow allowed the nurse to intervene, minimizing any potential interruption to the patient's infusion therapy. Now moving into the second scenario where the gap exists today. Later, the patient becomes unresponsive. Upon additional assessment, his nurse determines he is critically hypotensive. The nurse calls the on-call physician and receives an order to begin an infusion of norepinephrine. To rapidly stabilize the patient, the nurse decides not to wait for the physician to enter the Epic order and instead opts to manually program the space infusion pump and the lack of a verified order prevents us from actually continuing with the preferred auto-programming workflow.
So as the nurse, when I look back into Mark's chart, now I can see the norepinephrine that the physician has ordered. To do the back association, I'm going to start by scanning that drug barcode again. And this time, I'm going to set the time back to when the drug first started infusing into the patient. Now, I'm going to scan the device barcode again, fill out the form, and this time, instead of sending an order interface message to the pump, what it's going to do because of that back association is send a PCIM message or point of care identity management message to the InnoVision PCIM manager, which will then send it on to the BBraun pump. So I'll hit accept, which will trigger that message out.
Now that our back association has happened, our IV pump is now connected and able to send those alarms out to the handsets. A few hours later, the nurse will get a notification to the central monitoring dashboard and to their handset indicating a near end of an infusion. At which time the nurse will get information about where that alarm came from and the associated alarm, which is an end near infusion, and the nurse would be able to go back in, assess the patient and the medication, and make corrective actions as needed. You can see how this back association helps solve different issues that we see in real-time associations of these medical devices.